Over the next 27 hours, I will work 20 hours. So let's get this started so that we can get it over with. Today's already not gonna start out well. I am gonna be super late for work, but thankfully I'm my husband's relief, so he can just stay there until I get there. But this was not the plan, and I don't like feeling rushed, so we will see how this goes. So I totally forgot to introduce myself. My name is Sydney, and I'm a pediatric radiographer, and on the side I work with adults doing CAT scan. My x-ray tube is connected to the ceiling, so I have a full range of motion on what I can do in this room. And this is my upright bucky, where I do most of my exams. My son's school had parents do a day in the life video for our careers. So on this day, my son Sebastian came in and I helped him out with his video and he helped me out with mine. Chest x-rays are really similar with children and adults. The difference is that you're able to do an AP instead of a PA, so they're actually facing the camera rather than looking away from it. Sometimes on younger kids this helps them hold still so that they're not turning to look at where you're going when you walk away. I can break this down more on a pediatrics tips and tricks on how to image children, but here I'm just kind of demonstrating what I do in a regular day. Although I didn't make an exposure with him, since this is just pretend, the next clip you'll hear me give a little bit of a demonstration on breathing instructions for a child. Take a nice deep breath in, hold your breath, and you can breathe. Perfect, you can relax your arms. We are all finished. When we have exams to do in the emergency department, we often use our portable machine instead of bringing the children back to our room. We have 2 different size image receptors that we can use depending on what type of exam we're doing. The board that I'm using is called a papoose board. It helps us strap the babies in so that they're not kicking their legs, and then the parents are often in charge of holding their arms. And some parents are better at holding than others. This is the aftermath of a baby chest x-ray from how I perform the exam. Some radiographers choose to roll the infant up onto their side to take the lateral image, whereas I like to do a horizontal beam lateral where the image receptor is on the opposite side of the patient so that they are still able to lay on their back. It really helps with minimizing rotation, and it's also easier for the parent to hold onto their baby. We do trauma forearms all the time, so instead of a true lateral, we do a PA wrist with a lateral elbow, and then I tell the patient to rotate their shoulder up and then drop their elbow down so that you get a AP elbow and a lateral wrist. That'll take you a few times to get used to, so I'll let you sit with that. The biggest tip that I have for any skull work or facial bones is to create a small light field and then mark your light field before you even position the patient. When you do this, you're not forced to open up your light field in order to mark your image, and you know that your anatomy will all be included, but a lot of it does come down to just practice and repetition. So here I'm setting up for a pediatric chest because it is at 72 inches. Then I noticed that my laundry bin was getting full, so it is my responsibility to go ahead and take that out. We have to throw it into these giant bins that get collected to go over to the laundering facility. Some more housekeeping tasks for the department is just to fold these baby blankets so that they fit into our cabinet nicely. And we also have full sheets for the table for our older patients, teenagers, sometimes adults, depending on who shows up in the emergency department. This was thankfully the end of my shift with my pediatric patients. I just got home. It's 12:50 a.m. I'm gonna take a shower really quick and get ready to wake up in about 4 hours so that we can go CT some adults. See you in the morning. It is almost 6:30 a.m. I've had about 4 hours of sleep, and that's being generous. I guess I'm as ready as I'll ever be for a 12-hour shift. Thankfully, my sister works with me, so that'll be fun. I like working with her. This is my typical breakfast. Anyone who knows me knows that I'm not a healthy eater. This is the list of exams that we had for our outpatients today. This doesn't include any emergency department patients or floor patients. Hi, Ellie. This is Sydney from CAT Scan. Can I speak to the nurse room? Hi, James. Are you the nurse for? This is Sydney from CAT Scan. They put in an order for a belly. When would be a good time to send for her? Okay. Thank you. Bye. So we coordinate care with our floor patients because sometimes nurses need to come down with their patient depending on their oxygen requirement. Also respiratory might need to be involved. And some patients are just able to come down by wheelchair. So we call ahead, make sure that we're meeting all of their needs, and then we just prepare the room for their arrival. This is my CAT scan machine. People refer to it as the donut because it is not a tunnel like the MRI. It uses radiation in order to produce an image. Here I'm just demonstrating how the couch moves in and out of the gantry. You can change how quickly it moves in and out. If it moves quickly, then you're getting less detail in your image. If you move slowly, then you get greater detail. If you're a patient going into a CT scanner, this is a little bit like how it would sound. And from their view, this is what you would see moving in and out. The red laser just shows us our positioning lines, so it's really not doing anything to you.
I haven't dropped one since the first day when I was with you.
Yeah.
Going over, I haven't dropped it at all.
This is just my fault.
I was like, dang it.
This is my sister Samantha. The little piece on her left hand is really expensive, and it comes with the set of tubing. If you drop it, then you have to open up a whole new set. And that's what she was kind of explaining, is that on the first day that we worked together, she ended up dropping that little piece and needing to open up a whole new set. And she was blaming it on me. Apparently it was my fault, but here she is setting up new contrast for a new day. Along with the contrast, we hang a bag of saline. Our power injector will inject saline first to test out the line to make sure that a patient's IV will be able to withstand the pressure of the power injector. And then it will inject with the contrast. That way we can perform the exam with the enhanced vessels. Lastly, it'll perform another saline flush to kind of flush the line so that no contrast is making the line gunked up. For each exam that uses contrast, we use this system to select what exam we're performing to make sure that the flow rate is adequate. At our station, when we're performing a CT examination, we can have the patient laying in whatever type of orientation that they need to lay in order to perform the exam. You just have to make sure to select how they're actually laying on that screen. So for this patient, I'm setting up a combination study of a head and an abdomen. And all you have to do is select the body part that you need, and then you hit OK. Now, if a patient is expected to move or not be compliant, then you can reduce the scan time. Reducing the scan time will make your exam go quicker, but just remember that you're also losing detail when you do that. You can also change how you scan someone. So craniocaudal means that you're going from the head to the toes. Caudocranial is going from the toes to the head. You can use these arrows to move the table up and down without actually having to go into the room. I look super thrilled. I must have been hitting a wall on my level of exhaustion. So tilting the gantry is most often used whenever we're doing head examinations. There's a button to push behind the control panel prior to scanning that will tilt this automatically. It really is just super simple. The downside of working with adults is that you see really bad things happen pretty often. So we had an unresponsive patient come in, and this is me showing our tech assistant what her brain looked like. If you want to look at her head.
Yeah.
So blood shows up white.
Oh man.
So all of that's blood.
That's blood.
That's blood, that's blood.
Big old bleeds.
That's kind of where it's like originating from.
Yeah.
I mean, it's huge.
Man.
Yeah.
I wonder what she's even is even gonna have done for that. There's not much you really can do.
Yeah. No bueno. But it was interesting.
I'm guessing.
So here we're making some oral contrast for a patient to drink. Instead of highlighting the blood vessels, oral contrast will highlight the GI tract. So you're able to see the stomach and the small and large intestines by doing this. We don't want to drink straight contrast, so we dilute it in the water. And by doing so, it doesn't have much of a taste, from what I've heard. But in order to make it more appealing, we do have a couple options of flavoring packets that the patient can choose from. My weekend of work is over and I am headed home to spend the rest of the week with my family. I hope that you enjoyed coming to work with me today. If you have any questions about X-ray or CT, then go ahead and leave them in the comments below and I'll get back to you. And I will see you in the next one. Have a great day. Stay safe. Bye.